I think we can start. I'm starting to record now.
Okay, great. So welcome everyone. I wanted maybe we could just start with brief introductions. I know that there's a lot of people on the line, but I'd like for you to at least know who is here. So maybe we can just go around. Anissa, do you want to start by just introducing yourself?
Okay. Hi, everyone. I am Anissa Badawi. I'm currently working with Save the Children in Lebanon as Child Protection Technical Advisor.
Wonderful, welcome. And Claire, I'm just going down the list of participants. There's no order.
Okay. Hi, everyone. Can you hear me? I know I've got trouble with my Skype. Is it working?
Yep, we can hear you.
Okay, good. Hello, everybody. Claire Feinstein, Deputy Director, Child Protection Global Theme.
Great. And then let's see who is here. Oh, that's Sylvia. Sylvia, do you want to introduce yourself?
Hi, everyone. Yeah, this is Silvia Oñate. I'm Communications Manager for the Child Protection Global Theme.
Oh, wonderful. And Geoffrey?
Hi, good morning, everyone. I'm Geoffrey, Regional Representative, Child Protection Global Theme for Africa.
Wonderful. Thank you, Geoffrey. And then we have Gayan.
Hi everybody, I'm Guyana and I am Eastern Europe Knowledge Manager.
Wonderful, thank you. And then I'll introduce myself in a minute. And Kanarina?
Okay, hi everyone, I'm Kanarina Shehu, Child Protection Thematic Specialist from Save the Children Kosovo.
Oh, wonderful, great. And Bill, if you're there?
Bill is here. So, good morning, everyone. It's Bill from Head of Child Protection at Save the Children UK and co-chair of the Better Care Network.
Oh, wonderful. And then Sazan?
Hi, good morning. I'm Sazan. I'm with the search team with Save the Children in Denmark, currently deployed to the Ukraine office.
Okay, great. And I think Dina is just trying to join us from Save the Children Egypt as well. Let me just send her the link. Sorry about that. So my name is Rebecca Smith, and I'm the Children Without Appropriate Care Advisor for Save UK. And I'd like to present the tracking tool to tell you a little bit more about it and how to get involved and get interested in it. But if you have questions or you have points, we can have lots of questions at the end, and we can also, if you want to type any questions you have in the comments box as well, so that we can kind of make sure that we're getting all of the questions you have as we go along. I know it can be difficult with so many people, and Sylvia is going to help me with presenting a little bit. All right. So. First, I just wanted to start by introducing this tracking tool. And so this tracking tool that's come out has been created by a lot of different agencies coming together. And these were all agencies that also are part of this network called the Children Without Appropriate Parental Care Working Group based in Geneva that helped to draft the original guidelines for the alternative care of children. And what we realized is that as the guidelines have made progress, there's not a reporting mechanism. It's not like, the Convention on the Rights of the Child, where countries are required to kind of report on their progress. So it's very difficult to see the progress that countries have made in terms of really, nationalizing some of the key principles in the guidelines. So what we did was, together with the Better Care Network, we decided, let's look at the key points of the guidelines and really try and help countries to evaluate where they're at and how they can make progress going forward. Can you go to the next slide, Sylvia? Okay, great. And so the guidelines for the alternative care of children, as you know, was endorsed by the General Assembly in 2009. And it really is, it's helping to kind of look more at the Convention on the Rights of the Child, in more depth around standards relating to children's care. So it's supposed to complement all of the parts of the Convention of the Rights of the Child. It's really focusing on preventing child and family separation, and then if there is separation, ensuring the provision of appropriate alternative care. I know this isn't new to many of you that work on this, but I just kind of wanted to set it up as a beginning. And next slide, Sylvia. And it's complementary. So what we had done originally was come together to create this handbook called Implementing the Guidelines for the Alternative Care of Children, which has a lot of country examples from countries in which you work. And then it was followed by this online course on alternative care. And as many of you know, there was a big conference in Geneva in 2016 about alternative care, bringing in lots of experts from around the world and talking about how much progress we've made, but also where we're getting stuck. This online course, February 19th, is going to reopen again, so I really hope many of you join. It's completely free. It's open to anybody, so your partners or government agencies. It's a 6-week course, and we can talk a little bit more about it at the end of this discussion, but I just wanted to let you know about it. Sylvia, can you go to the next slide? Let's see. Yes, and so that's just a little bit more about the online course, and it will be interesting for me to get your feedback, just because you know, to see if it was accessible, to see if you thought it was helpful. We spent a lot of time and effort putting it together, so it would be great to get your feedback on it. I haven't participated in the whole course yet because I was on maternity leave when the first round came out, so I'm interested and eager to participate as well. So for this tracking tool, the next slide, Sylvia. So the aim of the tool is to really support national level actors to determine the extent to which their country is effectively implementing programming. And what we wanted to do was to try and break down each area of the tool, which I'll go into in a little bit more depth, and really help countries, so governments and civil society, working together as a coalition to try and enter in data that exists about different areas of alternative care in their country, playing to their strengths. So it's not a tool to say you're not doing this well and you're not doing that well, and but it's more to say this is how far you've gotten, and now here's what's left. It's supposed to enable cross-sectoral collaboration, and it's supposed to be really collaborative. So we ideally would hope that you could have a coalition filling this out together. It's not just one agency trying to put this together and then share it with the government. The tool has set the task that it's supposed to be realistic, but also challenging and worthwhile, if that makes sense. And data collection in some countries is going to be very challenging because, not a lot of data exists and there's gaps in data. And I think that this tool will help them identify those gaps. And in other places, there's going to be lots of data, and it's trying to sift through what is the most sort of reliable information. We've field tested the tool already in Romania, Rwanda, and Paraguay with different agencies. And so now we're trying to look to pilot it for the next stage. Sylvia, can you go to the next slide? So how does it work? So this is a web-based tool. We wanted something that we thought about using a paper tool because it would be much easier. But the problem with a paper tool is that if you answer no to one question, you have to skip over pages and pages of more in-depth questions, whereas a web-based tool, you can automatically skip over a set of questions and kind of just go towards the amount of data that you have. It's open source, so that we don't have to pay for some kind of usage fee or something like that. And it's been designed so that teams working on it can complete it over a period of time. It doesn't have to be completed at one step. So you can save data as you go along. Sorry. And then the tool and the data can be contained and updated on a regular basis. And it can also enable national authorities to provide comprehensive data over time. And then if you need it, so if your country is, going to report to the Committee on the Rights of the Child, you could use this information if you chose to go along with your CRC reporting. So you could also use it with treaty bodies or, with stakeholders at the national level. Okay, next slide, Sylvia. And yeah, if you do have questions, just because I'm kind of going in between, I will answer them in a minute. So the way that we framed it was just the way that the alternative care guidelines were framed, and that throughout the entire thing, the two principles of this tool are really taking into account the two basic principles in the guidelines. The principle of necessity, so ensuring that alternative care for any individual child is actually needed as a starting point, rather than, kind of looking at what kind of care exists. It's more, is it needed? And the second thing is it suitable? Does it match what the individual child needs? So that goes throughout the four overarching themes of the tool. Sylvia, can you go to the next slide? Okay. And so in the next slide, this is the tool. I'll show you the tool outside of this presentation because I know it's a bit small, but there are four thematic areas. And again, we tried to set up those four thematic areas based on the guidelines themselves. And the four thematic areas are, the first one is your country addressing factors that may lead to the need for alternative care? So this really looks more at prevention and what kinds of, are there schemes for looking at poverty? Are there things looking at access to education? What's the programming? What's happening for children with disabilities? That kind of thing. Because again, the whole point around alternative care is making sure that is it necessary? And are there ways that children can stay with their biological families as a first point? The second overarching theme is discouraging the use of formal alternative care unless it's necessary. So it's similar to the first theme, but really looking at, what other ways can we support family members and other people within that child's biological family to continue to provide quality care for their children. The third theme is ensuring that formal alternative care meets minimum standards. So the different types of alternative care options that are available meet the minimum standards. And then the fourth theme is ensuring that alternative care meets the best interest of the child. Are you matching the needs of the child with the, with the actual types of care that are available? And then we have 6 cross-cutting themes, and these are a bit different than some of the others. One of the cross-cutting issues which goes through each of the themes is committing, a commitment to the international standards that already exist. So I talked a lot about the Convention on the Rights of the Child already, but also the Convention on the Rights of Persons with Disabilities. And then in Africa, the African Charter on the Rights and Welfare of the Child. So it's framing this, just like the guidelines were framed to help complement the Convention on the Rights of the Child. This tool is helping to complement other, international child rights instruments that do exist already. The second cross-cutting theme is that children and families participate in all aspects of alternative care, including children at risk of being placed in care. So again, this isn't new to Save the Children, but it might be new to a lot of the partners that we're working with, is that how do we look at child participation and families participating in this process. The third cross-cutting theme is making sure that the best interest of the child really underpins all decisions related to alternative care. It is very difficult to say, this for all children in this circumstance, this will work. So it's really trying to look at these individual needs and understanding through the best interest of the child what's most appropriate for the child. The fourth theme is a commitment to the rights of children and families who may be discriminated against. So this includes children with disabilities, children's gender, children's religion or ethnic group, any reason why children might be more prone to being placed in care. And it also includes how do we help carers who may be disabled themselves. So really looking at the most marginalized in a community and making sure that the government and civil society are trying to recognize the specific needs of those people. The fifth area is the importance of taking into account the stages of child development. So looking at children, especially the very young, under 3, and what the most appropriate placement for them would be, and also for those moving from care into young adulthood. I'm really sorry, I'm fighting a cold. But so there's been a lot of research looking at the challenges in children aging out of care, and how does the government and how does civil society help to respond to those who are no longer allowed to stay in the care that they were in, and how do they transition into adulthood. And then the last cross-cutting theme is the availability of sufficient numbers of competent human resources. I think those of us working in child protection, this is an ongoing challenge in terms of how do we make sure that there are professionals and staff and carers that are really trained and paid to support children and families in different forms of alternative care, and to help support families to keep their children in the biological family. So those are the different themes that go throughout the tool. So we've been tasked with taking these kind of very theoretical concepts and making them as practical as possible, and trying to give countries the ability to figure out where they would find the data, and then how they would enter it into this tool. Sylvia, can you go to the next slide, please? So the tool should be applied with a variety of sources, qualitative and quantitative data. We recognize that some countries might have a lot of data that they collect on a regular basis on children in their countries already, and that would be really easy to enter. We recognize that other countries, there's going to be a real gap of data. So you input your information, you identify gaps in data and implementation, and that can help in terms of fundraising. It can help in terms of trying to figure out who's going to be doing what where. And you can also explain, if you have limited data and you recognize it's not completely accurate, you can also write that into the tool, because there is qualitative, there are parts where you can say this is the data that exists, but we're not exactly sure of its accuracy, or it only covers one area of the country. Wherever possible, you should try to get the most accurate data and have it independently verified. And in many countries, there's limited information that's available, but it can be helpful when completing the tool to indicate the type of evidence that's used, just to point out any limitations. And one of the benefits to completing the tool is that you'll have a better understanding of what data is out there and where data is missing, which again can be helpful in terms of reporting to different treaty bodies, and it can also be helpful in terms of fundraising and saying, actually, we need to do more data collection in this area, or we need to be looking at these rural areas that we don't have any information on, and also advocacy together with the government. Next slide, Sylvia. So under each key theme, what you can do is, you can help to input the information regularly, analyze the data over time, and measure your progress. So throughout the tool, you enter in all of your information, and then at the end a report is generated. But all of that information is saved along the way. And you can decide within the country whether or not you would like the data to be saved globally, or whether or not you just want it saved within your own country. That depends on the capacity of the country, and it depends on, your own networks. But if the country doesn't feel like they want that data to go anywhere else, that's absolutely fine. Again, this isn't a tool to shame countries, or it's a tool to help countries at the country level to have, show the progress that they're making. It's supposed to promote the well-being of children without parental care and facilitate, a national baseline of systems and services to support children's care in that country. And, it also can be a planning resource for the government to help agencies figure out what's needed going forward. It can also promote the guidelines more widely to decision makers and policymakers, and raise awareness of the national situation of children in the countries. Next slide, Sylvia. So who can use it? Ideally, what we were thinking with this group with this tool is that you would convene a national working group to really work on this issue of key actors that are already working on these, working in somehow either related to alternative care or prevention or family strengthening, and bringing them together, bringing government, UN agencies, civil society, and stakeholders together. We thought that would be the best way to provide a comprehensive report. And again, because it's supposed to be strength-based, what we don't want is a report coming out that the government has had no say in and then doesn't acknowledge. So, ideally you would have organizations working together to produce this report. Like I said before, it can be owned and managed at the national level. It could be hosted on a local server or a global server, depending on what's most useful and helpful in that country. And it's a free tool that can evolve with the needs and the context over time. It was really challenging for us to try and find a web-based tool that was open source, but we thought that it really made sense, because then it doesn't tie us to some kind of fees or, limit the number of users that can have it. What happens next? Next slide, Sylvia. So now we're trying to develop guidance and training materials for the country levels based on the experience of using this tool in 5 countries. We're trying to pilot the tool representing, different socioeconomic contexts, different types of care systems, different stages of development or reform. When we first launched this tool, we launched it at the Opening Doors campaign in Europe. So, not just thinking of developing countries, but also quite developed countries already. To really look at a variety of systems, and I think that's where hosting it on a national server, for example, the Austrian government might be very interested in using this, but they don't want any of the information to leave the country, which is fine. This tool doesn't belong to one agency. It is an interagency tool that is made for the purpose of this, bringing it out to the countries, to be used at the country level. So it's not, then Save the Children's going to collect all of this information and have, comparative data across many different countries. It's for the country programs to use. And ideally, we have presented this to the Committee on the Rights of the Child to say, this does exist if countries are interested when they are presenting their report to include this information. That would be really useful. Do you have any questions so far? Before I want to show you the actual tool itself. We've tried to make it as simplified as possible. But if you have any questions, if you could just either type them in the text box, or I don't know if there's a way to raise your hand. Okay, I see people typing, so fantastic. How was the reception of the governments in the pilot phase? I mean, I think it was very positive, but like I said, we didn't pilot it in some more, it was countries that wanted it anyway. So Romania, Rwanda, and Paraguay. I think there might be a different reception from other countries, potentially. But I think it's also how it's presented and what the relationship you have with the government to begin with. So I don't think this is a starting point. Ideally, this would be, okay, we've started working on some of these issues. Let's look at it together more comprehensively. And because it is strengths-based, I don't think the government will find the questions challenging. I think it's more what exists, what doesn't exist. You know, we've really tried not to make it judgmental as much as possible. And I think also being able to say, you know, this is not feeding up to anything. You know, the owners are the people who are filling in the information. And we're hoping that by saying, you know, what is the level of the data and where did it come from, it helps to show, like if you're trying to skew the results, then you also, it does show where the data came from, so you can follow up on that information. Does that answer your question, Jeffrey? Okay, great. Anissa, did you have a question? Okay. The other thing, Jeffrey, I think you had asked also about a French version. There's a Spanish version right now because it was piloted in Paraguay. We are looking for funding for a French version because I think that would be really helpful, but it doesn't exist right now. For our Spanish colleagues, they, you know, the IT guy who helped create this tool is actually he is currently based in South America, which is helpful in terms of looking at the translation for the tool as well. Yes, we do need a French version. Well, for online course, is it planned to be conducted in other languages than English? Oh, Arabic. Well, Jeffrey, let's. Yes, I agree. There should be lots of translation. Yes. And Arabic will be very important. Let me show you.
Rebecca?
Yes?
Hi, this is Dina Ghunaim from Egypt office, and I have with me my colleague Hiba Ahmed. We've managed to finally get connected.
Wonderful. Welcome, welcome. We've also recorded the presentation so far. I'm just about to show the online tool, so hopefully you'll be able to see how it works. But okay. Feel free to step in with questions.
Okay.
Great. Thank you. Welcome. I'm glad you're joining. So let me just see if I can show you the tool itself. Okay. See if I can, let's see, share a window. Okay. So this is the tracking tool, and from the last page of the let's see, can you see that? I hope. No?
It's loading now, Becky.
Okay.
So it should show up now.
Hopefully. Okay. Let's see. It's just people are now seeing. You can also go to www.trackingprogressinitiative.org to play around with the tool yourself. Oh, you can see it now. Hooray! Excellent. Okay, so let me just talk you through it because we spent so much time and effort trying to make it simple and useful. So there's a whole section on how to use the tool. And then because I can't see your questions, Sylvia, if people have questions in the comment box, just let me know.
Yeah, I will let you know.
Okay. So if you go to step by step, it really breaks it down. So how do you build your team? How, who should be involved in this multi-agency working group? How do you prepare to use the tool? And it really, again, we tried to make it as simplified as possible because what we don't want is everyone trying to fill in the tool without having collected the information yet. The tool is really simple, but getting the data takes time. So trying to figure out what information you'll need, making a plan for collecting data, and there's a little, step 4, gathering data, that you can click on to really think through where you would get information, deciding who will collect it, sources of data, and we give you suggestions about where you would get sources, the types of evidence that exist, quantitative information and qualitative, and we really go through, different agencies, demographic health surveys, multiple indicator cluster surveys. We've tried to give as much information as possible. Talks about storing data and how you can decide whether or not you want your information stored on a global server or not, and what kind of technical areas do you want on your that you would need on a national server to use the tool, how to enter in the data. So, and also managing data. So, the idea would be you have a team, but hold on, how do I, choosing an approach, gathering the data, managing users. So the idea would be, even if you had lots of people, you would still have one person who was responsible for each area of entering the data, so that not everyone is entering data all willy-nilly. That you discuss, you have maybe a meeting where you all come together, a workshop, and then one person enters in the information just for consistency. But you can decide who that is and how that works. And then there's also a section on analyzing and comparing data, which we thought was the whole point of the tool, is that you would then be able to generate reports based on it. You'd be able to compare data from, that over time, or from other parts of the country if you wanted to do for one aspect of the country. And then you also have little video tutorials which help to kind of troubleshoot some of the areas you might get stuck in, how to complete the survey, how to return to a survey, how to compare survey data, and how to generate a chart of your data, and how to use the follow-up plan. So what's next? So again, we try to make it simplified and useful. We have an IT person who's still supporting the IT components of this, at least for a little bit longer, but we wanted to make it as, we didn't want it to be that he needs to help everywhere. It's kind of fixing the bugs and getting where, finding any problems with the tool itself, rather than having to be like an administrator for the tool. And then you can sign up to get an email with a username and password to help, to then use the tool. And what I would say is, you can email them directly, but I would like to know if you, as Save the Children, are going to be using this tool or trying to get people together to see if there's interest in the tool, just so I can help support as well. So that's what it is, and you can see the www.trackingprogressinitiative.org, and you could go through it yourself just to see, would a country that you are supporting or working in be interested? Could there be that kind of national working group? Does it exist already? And if you're interested in piloting this going forward, please do let me know, because I think in terms of money for the piloting, I don't think it will cost very much. It's just trying to make sure everyone is available and has the time, maybe a little bit of money for a workshop. And then also, making sure that everyone has their designated tasks and what they're going to do going forward. But again, that's all about trying to figure out, what is the tool, who should be around the table, and what is needed. But in terms of financing this, I don't think, inputting into the tool is very expensive in and of itself. Can I open it up to more questions? Yes, more on the tool itself if you have any questions. Yeah, please. speak.
Yeah, it's not on the tool itself, actually. What just about what you were saying, financing. I do agree that this is not. I mean, I don't think this is a lot of money. However, fundraising specific. I mean, I want to link that up first with emergencies. Working on alternative care in emergencies context, which might be very challenging. I mean, first of all, when an emergency starts, we often try to set up the whole case management process, which might take some time, family tracing or for other issues. And the alternative care component often comes after a while, and it's very difficult, as we were referring to get the government involved, engaged, to get access to data and so on and so forth, and that might come much later into the crisis. That's the case in Lebanon, for instance, where I'm working now. So I guess my question is about how, or is there any plans to link that up with emergencies context, including protracted emergencies context, and how can we help? And also, how can we look into fundraising, or funding opportunities rather, to work on alternative care within emergency context? I'm facing this, and it's quite challenging to be able to actually either identify the funding sources for alternative care specifically, or convince basically the stakeholders and actors to get in on that topic.
No, definitely. It is a challenging process. I wouldn't suggest using this tool in the first phase of an emergency. Definitely in a protracted crisis, there's no reason why this couldn't be used. I think one of the things you would need to think about when you're putting together your mapping is making sure that you're thinking about, okay, does this also apply for refugees or IDPs in your country? Are there other marginalized groups that are not being assisted in the same way that national groups are? So we need to look at them more specifically. And I kind of see this tool as a way of being able to show donors that you are mapping this is a gap, that it doesn't exist. We have, we brought together people who are interested in this issue, and therefore we need to fundraise for it. So I see it as kind of being a little bit more, being able to show, look, we've done our homework. This is part of the problem that we've identified, and therefore now we have this coalition of people who are going to work on it. So I don't see it being useful in the first phase of an emergency, but I definitely see it being useful in a protracted crisis in terms of trying to figure out what are the needs of children who are displaced, and how does that, how do we provide alternative care in those settings? I don't know if that really answers I know fundraising for alternative care full stop is a real challenge. But I think part of that, a lot of people are saying we don't see the need for it, and helping to kind of more comprehensively map the need helps to give you a more compelling case to donors, is what I would say. Does that slightly answer your question? No, so we were not part of the pilot countries originally, and part of that was just, fundraising in countries that were interested and open. We have thought about potentially the next phase, the pilot countries. We were thinking about trying to pilot this either in Indonesia or Cambodia, just because we have a large alternative care program there now. I don't know if this is something that Lebanon or Jordan would be interested in. Obviously, without the Arabic is much more challenging. But yeah, I am very keen for Save the Children to be more involved with this going forward, because we've been so involved with the creation of the tool itself. But we have not been involved with the piloting. So Hope in Homes did the piloting in Rwanda, and I believe, I'm not sure if they were in Paraguay as well. No, I think that was RELAF in Paraguay. And Romania, I think, I can't remember which agency it might have in SOS Children's Villages. I'm not positive. But we wanted to really test it in a variety of different locations. Obviously, the amount of data that's available in Rwanda is very different than the amount of data that's available in Romania. And the types of reasons why children are institutionalized is very different in those countries and context. So we're trying to get a whole range of different countries and context represented here, and make it the most useful. So, getting people's feedback is fantastic about, even if it's feedback as to why you feel this wouldn't work in your country or context, would be helpful as well. So the piloting for resources required, I honestly don't think it would be that much money. I think it's more, okay, you have a network. Can someone host a meeting or a workshop, and what's needed in that workshop? Do you need refreshments? Do you need, it doesn't even need to be a full day workshop. It could be a half day, bringing people together, deciding who's going to collect what data, sharing the cost amongst agencies, so different agencies who already have paid staff, so you're not paying someone to go out and collect this data. It's more people who already exist will bring in different parts. So I don't think that it would be very expensive. It's more bringing together the people, having the time to look at it, making sure those people have, that it's part of the work they're already doing, so it's not outside of their daily work, and then having it come together, and maybe also once the report is finalized, figuring out some kind of launch or sharing of the information, either internally if you think there's lots of gaps, or shouting about how fantastic you're doing. Either way. But I don't think the completion of the data, putting data that already exists into this tool is not expensive. The more expensive piece would be is if you've identified gaps in data and you want to then try and fundraise to collect that information.
Yeah, I think, Becky, I do agree that in terms of the direct resources required might not be a lot, but the prerequisite, I believe, should be a working group which is in existence, and that you have agencies, including collaboration with UN and government, who are committed to work on care and especially care reform. If that group is there and in existence, it should be able to take off quite easily. If it's not in existence, then probably there needs to be a lot of work done to get that up and running before this can be introduced and before it works.
No, I agree with you, Jeffrey. And I also think, the whole point is to then be able to have a baseline of where you're at and where you want to go forward. So it's also, why would you collect this? If no one's working on care in your country at the moment, then unless you're using this tool as a way to get started to look at care reform, then it's not useful as much either. So it's also, if you're already working on different parts, but you want something more comprehensive, that seems like a great prerequisite.
Can I ask a question, Rebecca?
Yeah, please.
Yeah, I just wanted to figure out when the data is collected, can it serve also as a benchmarks in order for countries to understand where to go? Or it's more like a baseline? So I'm not familiar, so...
Yes, so the idea would be, because you can collect information at different periods of time, you could also save the information that you got. So you could say, okay, well, this is where we were in 2018, and then go back and do it again in 2020 and see what's changed. You could also add in information that's missing at a later date if you've decided, okay, we didn't have we had all of this quantitative information, but we're missing some of the qualitative information, and then you come back and add that in later. And then, it can be helpful in that way. Does that answer your question? Sorry, I lost track of.
Yes, thank you.
Okay. Anissa, are you back with us? Sorry. Oh, wonderful. No, no worries. Technology is challenging. We've also recorded this phone call because I know a lot of people wanted to attend but couldn't. But I am open. You know, I have my email address on the last slide, re.smith@savethechildren.org.uk. So if you're interested in, piloting it or have more questions about it or would like us to talk more, yep, I can share the PowerPoint as well. Yep. And if you want me to present to your network that you're already working with, absolutely. I'm happy to do that. This tool took us probably about 2.5 years to create, just because it was really trying to take these really high-level questions and make them very specific and related to data that we thought could exist, that it was practical. We don't want this to be a global tool. We want this to be a country-owned tool, and I think it's really challenging at a global level to try and create that. So we need your interest in ownership to make sure that it does actually is tailored to the needs that you have in your countries. Yeah. Yeah, and Anissa, if it's, if you present it to people and it sounds like they are interested, let me know. And if, they just have more questions, that's fine as well. So it's just finding the timing. But yeah, letting you know that it's there. And also, the other thing is, please do join the online course on alternative care. Will be started, I think, February 19th. I've sent that around to the working group. So please do join that as well. It's just once a week, and it is facilitated by the University of Strathclyde in Glasgow. So hopefully there's lots of people from around the world that can kind of pipe in and use, type their experiences and share their learning. I think it's been really interesting to see where different countries are getting stuck and what kinds of, I think it's useful for our task group as well to see where are people struggling in terms of alternative care. I think we've done a lot of good work at raising awareness as to why residential care is harmful, but now we need to kind of look at the next steps and say, what does quality alternative care look like for those children that need it, and how do we look at it contextually in different places? I see Jeffrey typing away. Yes. Countries in Africa that might be interested, let me know. Yes, please, and vice versa, Jeffrey. I think there used to be quite more work on alternative care that Save the Children was doing in Africa, and I think we don't have as much right now. So we will let each other know, I think. Definitely. And it would also, I'll let you know as well if it seems like there are other agencies that are using the tool in different places. I mean, it may be that, Stahili or other organizations in Kenya might want to use this, within Kenya. It's possible. So I will let you know. Any last questions or comments on this happy cold Wednesday in the UK? Well, wonderful. Thank you so much for participating. I know it's challenging to find a time that everyone can make, but do feel free to contact me, and we will make the materials available. And hopefully, now that we've gotten onto the right link, we've saved the recording so that we can share this presentation as well. Wonderful, Anissa. I hope you are. Thank you very much. Thank you all. Thanks, Sazan, and thank you for our Egyptian colleagues as well. I'm glad you finally made it on the call. All right.